Good morning, good morning, good morning. My name is Lynetris Williams. I am a nurse with over 22 years of experience in nursing. I am excited about the opportunity to audition for Kaplan as an instructor, and I believe I have just the right amount of experience and motivation and expertise to be an excellent candidate for this position. I have 22 years experience in nursing, which ranges in the areas of emergency medicine, critical care, med surg, geriatrics, leadership, and education. From a clinical perspective, I have actually worked in various areas in various capacities, ranging from anywhere from the unit nurse to the charge nurse to a clinical nurse specialist, a manager, or director. I love nursing and I love to talk to people. I like to break concepts down into simple concepts that make it easy to understand. I've always been told I have a knack to allow people to understand complex that seems so far fetched that, it becomes quite simple to them when I can break it down to them in a way that they can understand. I love it when I can see that aha moment and the light bulb goes off. Whether it's in the clinical setting or in the classroom setting, I feel that it's always important to make people comfortable when you're having a conversation, when you're trying to explain concepts to them. Because if they're uncomfortable or feel like there's an environment that they're not open to be able to ask questions or have their concerns conveyed or addressed, I feel like it limits the ability for us to actually have a good exchange of information. I have nursing in my DNA. I love talking about nursing. I love teaching nursing. I love looking at practices and figuring out what we can do to enhance the practice and profession of nursing. I believe that that is something that you have to actually have a passion for. And that is why I believe that I would be a good candidate to teach at Kaplan because I do have an innate ability to communicate with people. I have an openness and a willingness to get down and break down those concepts so that you really can grasp and understand. I've had the opportunity to teach students in both the clinical setting. Initially, I started off as a clinical instructor. I've been doing that now for about 7 years. What I realized is that clinical is that opportunity where you can help put some pieces together, where you're trying to transition them more from the books and get them to understand how to apply that knowledge into practice. I like to be able to get them to understand that sometimes what you see in the real setting is not what you necessarily read about in the book. So you have to have a way of being able to separate, what you're seeing in the clinical setting and what you're reading so that you understand that you have to understand the basic dynamics of the practice to be able to recognize what's right and what's wrong and to decipher what's best for your patient. I also feel like I'm a good candidate for Kaplan because I feel like I am a people person and a natural motivator. I'm good at engaging people. I'm good at engaging people in conversation, asking the pertinent questions, getting the flow of the energy in the room going. And I think that that's what's needed. I think that you have to engage the audience, get everyone involved so that you can actually have a good conversation. I am actually available to teach on at any point, weekends, weekdays, evenings. I have a flexible schedule and I am willing to learn the concepts that we actually have to do at Kaplan to make sure that the student is successful. So, with that being said, I'd like to take some time and go into my presentation of the information. Um, Here we go. So, good morning, team. Welcome, welcome, welcome. You must feel like you have accomplished a huge feat. You have done what so many people have tried but failed to do. So everyone in this room should give themselves a round of applause. You have done so well in an area that so many people have tried to conquer. But now you have one more thing that you have to do before you become the nurse that you always knew you wanted to be. You have to pass the NCLEX. You have to pass the NCLEX. And guess what? You will. We are actually here to make sure that you have all the tools you need to be successful on your NCLEX exam. There are some strategies that you might have to understand so that you can actually incorporate them into your decision making when you're looking at your questions. And I say that because sometimes when we look at the test, we might get overwhelmed. Well, at Kaplan, this is the opportunity for us to help relieve some of that test taking anxiety and actually help you to understand how to break the questions down to get to the answer at hand. So I have a question for you. Who can tell me some test taking strategies to utilize when they need to answer a question when they're looking at the actual test? You make a great point. You should never overthink the question. Don't read more into it. How about you? Excellent point. The thing is, don't go on a neck. You have to actually break down the information. That is correct. What do you think? Absolutely. If you're not 100% sure that that is the answer, look at what it's asking. Only look at what's there. Do not read or feed into it. So let's take a look at a couple of questions. We have two questions here that we need to look at. And as you know, when you're taking a test, that you need to know the main thing that you want to make sure of is that your patient is safe, that your patient is safe, and that you're doing the best practice to make sure that they are safe. So in this first question that we look at, it says that the nurse cares for a patient 4 hours after admission to the neuroscience unit due to a closed head injury. Which of the following is the most important action for the nurse to follow? So take a couple seconds to glance over the answers. Remember, you're looking for what is the most. So you need to be able to, number one, prioritize. Make sure that you prioritize. Now that you've had a few moments to look at the questions, let's look at the answers. So the first answer says that we are looking for a change in pupil size or reactivity, which is an early sign of increased intracranial pressure. Report to the physician immediately. By a show of hands, how many people think that that's the right answer? Okay. Well, let's look at the second answer. Take the patient's rectal temperature. By a show of hands, who thinks that's the right answer? All right. And number 3, assess the blood pressure and apical heart rate. Show of hands, who thinks that's right? And number 4, we're going to observe the patient's oxygen saturation level. Show of hands. All right. Well, the answer is number 1. And the reason number 1 is the most important answer is because you need to make sure that you need to assess the patient. You need to determine what is going on with the patient right now. Assessment, assessment, assessment. And yes, taking a rectal temperature is something that you could do, but it's not the priority. You need to look at the fact that this person is 4 hours post-op on a neuroscience unit. They've had on a closed head injury. You need to make sure when someone has a head injury that what? Correct. That they don't have increased intracranial pressure. So yes, you could take the rectal temperature, but that's not going to give you all the concrete information that you need. So we can cross that one out, right? Yes, we are going to assess the blood pressure and the heart rate. But remember, with assessment, you need to make sure that they do not have the increased intracranial pressure. So the vital signs aren't really an immediate sign, because that's later. That's something that's going to increase as time goes on. And yes, we should look at the oxygen saturation, but the fact of the matter is the oxygen saturation is not going to be a priority, because carbon dioxide levels will increase as intracranial pressure raises, correct? So now that you've broken the answers down into those components, you understand that the most important thing right now is to assess that person to make sure that their pupils are what? Correct. It must be equal, reactive, responsive. It has to accommodate. You want to make sure that the eyes are doing everything that it needs to do. So that would be your answer. And when you find out that answer, you must report those findings to the physician or the nurse practitioner, whoever it is that's actually taking care of the patient at the time. But the most important thing is patient safety. Increased intracranial pressure is a medical emergency, and we need to make sure that our patient is safe. Do you understand the concept? Are there any questions? Great. Let's take a look at the second question. The home health aide nurse plans patient visits for the day. Which patient should they see first? Now, let's keep in mind, you know that as a nurse, you have to know how to take care of a team, because the fact of the matter is, when you become a nurse, you're not just going to have the one or two patients that you're assigned in clinical. You're going to have a team. So you need to know what you need to do for whom, when, right? Absolutely. Take a moment to look at the questions. Take a moment to look at the answers, Okay, great. So we have a 70-year-old diabetic with fasting blood glucose readings of 240 to 260 for the week. Okay? We have a 65-year-old discharged from the hospital 2 days ago with coronary artery bypass. So if you think one was the answer, raise your hand. Remember, no intimidation. We just want to see what we think. All right. How many for two? The 65-year-old discharged from the hospital 2 days ago following a coronary artery bypass surgery. So they got a cabbage. So that's like they opened the chest. Okay. Third, a 55-year-old with congestive heart failure who has gained 3 pounds in 24 hours. Show of hands. Okay. A 40-year-old with metastatic breast cancer complaining of pain relieved by pain meds. Show of hands. Okay. Well, the answer is 3. The 55-year-old with the 3-pound weight gain in 24 hours. Remember, with congestive heart failure, they're supposed to measure their weights when? Correct. Usually they should measure their weight on a daily basis. So someone who has had a 3-pound weight gain is retaining what? Absolutely. They're retaining fluid. And this is a person who can easily have a cardiac or respiratory compromise. And remember, what we said are the important things that we have to look at when we're taking care of our patients. Making sure they are safe. So to get the best, to make sure that we prioritize to keep our patients safe. So the 70-year-old who has a blood sugar of 240 to 260 for the week, we might need to do some teaching and maybe look at a diet, right? We might need to figure out what could be contributing to those things. But this person isn't hypoglycemic to, their blood sugars aren't hyperglycemic to the point where it's causing any other effects. Remember, it didn't tell you anything, so you don't read any more into it, right? So this is a person who, yes, it is important that you see them. However, it is not the first person you should see. This is a person you should see second. When you look at the person who's had the cabbage, yes, they may need some teaching done, but it does not require anything emergent. They're not complaining of chest pain. They're not complaining of shortness of breath. There's nothing coming out of the wound. Remember, don't read into the question. And then you have the 40-year-old with the metastatic breast cancer who's having some pain. This person you'd see last because they're having some discomfort. Yes, their pain is unrelieved by the pain medication. However, you want to make sure that this person, they're stable. They're uncomfortable. You can give them some cues of some things that they can do to feel better non-pharmacologically until you can get there to assess what's going on. But that is not a medical emergency. Remember, when you're making your decisions to answer your questions, make sure that you keep your priorities in place. Remember when you're looking at nursing that your main thing is to prioritize. On this test, they're looking at the fact, do you know how to prioritize? Do you know when to delegate? Do you know how to keep the person safe? Do you know how to make sure that the person has everything that they need? Can you look at something acute or chronic? So these are all the things that we're going to dive into today during this presentation of the questions to make sure that you are absolutely successful when you walk out of these doors. That's what we're here for at Kaplan, to make sure that you have all the tools to increase your confidence, decrease that test anxiety, to make sure you can pass the test the first time. Thank you for coming out today. And if you have any questions, please don't hesitate to reach out to us. Thank you.